We did not want to let cancer define Valerie. You have to trust the team that's looking after you, be it your doctors, your family, your friends. Everyone has your back. I think that we have to realize that every day is a gift. And, every extra day that we have had with Valerie or with anyone has really been a blessing. I think it's very important to say every day to your family that you love them and to greet the world with a smile and not be suspicious. So Valerie and I are very happy to be here with you this afternoon. 35 years ago, Valerie embarked upon a journey with Medulloblastoma. She was 4.5, and she was quite the happy-go-lucky child. Carefree existence within our family, with the siblings, and all was going very, very well until we noticed a slight trembling of the hand. This was unusual. Valerie then started requesting to take little naps. And just to be on the safe side, we contacted a friend who was a GP here in France who came by and lined up our 4 children, had them all do a little test, touch the nose, stand on one foot, stand on the other. And he then said, it might be a good idea to get this checked out. And so to be on the safe side, Valerie was taken to the Children's Hospital in Lyon, and a CAT scan was done, and it became immediately apparent that there definitely was something going on. So this was how we were introduced to medulloblastoma. Okay, Valerie, this is her story, actually. I've been accompanying her, as has her father and her 3 siblings. Okay.
Fantastic. Thank you for sharing that. Is that, I don't want to go off subject straight away, but I'll just briefly say who I am. I'm a parent of a survivor of childhood leukemia, and I've been involved in some advocacy work. So it's great to hear your story and how it all began such a long time ago. So it must have been incredibly traumatic for you and your husband, your daughter, and all the siblings as well. I can't imagine that situation happening now where all the siblings would be there together. I don't think that sort of thing doesn't really happen now, does it?
No. Or that the siblings have been all over the world to other places. But fortunately, for the moment, we do have Valerie lives, 15 minutes away from us, your other sister 10, another sister maybe 20, and then your brother is in the U.S. So the family has spread out quite a bit, but that is also because I guess we were traveling pigeons, all of us, and studies took people in different directions.
I saw in your article that you traveled to various different countries. How was that? Was that extremely difficult navigating health systems in different countries?
No, actually, it worked out very, very well. We did not want to let cancer define Valerie and say we have to stay in Lyon and stay with the doctors that we know, the hospitals. We said, there's a world out there and people communicate. Doctors communicate, they know one another, they can transfer information. And we moved from France to the UK with a very thick file, but also with the knowledge that we would be seeing a former doctor of Valerie's, a pediatric oncologist who had treated her in Lyon and then was living in the UK. And our time in the UK was what, Valerie would say 2 years? Yeah. 2 years in the UK. And then we moved on to Norway. And when we got that bit of news that we would be going there, we informed the doctors, the entire medical team in the UK, and they prepared a marvelous file for us, gave us names to look for. So it was a very smooth transition. And I have to say, we appreciated that so much because it could have been very difficult, but it was made very smooth by the cooperation between the medical teams in various countries. Valerie stayed in Norway for 7 years. Her father and I moved back to France after 6, and she, did very well in the Norwegian system on her own. After a year, she did decide to come back to France, and her father and I moved to Tokyo. And while we were in Tokyo, Valerie came for a visit and started having headaches and occasional vision issues. So we did consult with a neurologist who said, best to have a CAT scan. And as soon as she returned back to France, so we came back and there was a need for surgery to correct an issue of the spinal fluid not moving freely. So that was taken care of, and that was a Brazilian neurosurgeon in Lyon. So after that, she went kayaking. 3 months later, she went back visiting friends in Norway, checking out the seals in the fjord and getting on with life. And I think that's the thing that Valerie amazes us with. She has such a positive attitude, and she gets on with things. She just moves forward.
That's amazing. What a beautiful story. Valerie, what do you remember of all of this? Because you were so young when this all started.
Yeah, with me all. I was spoke. I remember. I remember the one who was sharing the room with me.
In the hospital? Yeah, Jean-Paul?
Mm-hmm. Yeah, and his dad we sing every night the take a child by the hand. But the one when he woke up of his operation, he was blind. But he always knew when it was me when I was walking the hallway.
You're right.
Yeah. Well, I should introduce. I'm Jaime Libes. I'm a pediatric oncologist in the United States. And so I work with children who have all different types of cancers. And it's always amazing to see how kids move on after completion of therapy and how really things change how you look at your future. And so I'm so happy to hear that you've been all over the world and really doing these amazing things. What kind of message would you give to other kids who go through something similar to what you've gone through?
I'd have to ask your mom. Yeah.
We've talked about this earlier. So she said, I think Valerie's message, as it related to me, was you have to trust the team that's looking after you, be it your doctors, your family, your friends. Everyone has your back. Everyone's goal is for you to get well. So you have to be bold. You have to go forward. And that is really what she does all the time. She is the one that makes people smile around her and gives courage to so many people. Valerie has had her challenges. School was difficult. Learning to read, very challenging. I think the international protocol at the time M8. There was an awful lot of radiation that she received. And many of the children who had not learned to read previous to that had difficulty. So school was challenging, but Valerie compensated in other ways for that. She was able to do things orally. She attended junior college for a year in the U.S. in New Hampshire and passed her exams orally. But the issue is that she does need more time to complete work. So that has, hampered some things, but not everything. She's found other ways, to make herself useful and happy.
Yeah.
Yeah. And
That's a very interesting way of answering the question, saying trust the team, because I think there can be, it sounds quite an obvious thing to say, to trust the team, but I think there isn't necessarily trust there, is there? I think some people think, oh, the doctors aren't telling me all the information, or there's something going on that I'm not being told, perhaps sometimes irrationally. So that's very interesting to say trust the team. And it's you're definitely going to have a better outcome as well if you're trusting rather than suspicious. I'm just going to go back to your story about traveling to different countries, and Jaime should be able to comment on this as well. I think for a lot of families, and this isn't a criticism at all. I think a lot of families put everything on hold when they're on treatment or just after treatment, and just after treatment can then extend for a long time. And we tried not to, but my daughter wasn't too ill, so it wasn't too much of a difficult thing. But it's easy to say do all these things, but it's quite difficult, isn't it? And it really requires, you have to really think about it and really be determined to do it, don't you? And for some families, it's just not possible, is it, Jaime? I'm sure there must be some families where you just say, we really want you to be near here so we can carry on. I guess that must happen a fair bit.
During therapy, especially when kids have central lines in and we're afraid that the reflection, those kind of things really do limit activity. But afterwards, we really do hope that kids get back to as much of a normal life as possible. And even during therapy, we try to encourage kids to continue to really be kids and continue to play and make sense. And, obviously with some limitations, but we really do want as much normalcy as possible.
Yeah,
right.
Lucy must help the healing process as well, mustn't it? It's not just to make everyone feel a little bit better. It must have long-term, or it should have long-term benefits as well, shouldn't it? Trying to get everything back to as normal as possible, as quickly as possible. There must be benefits in that, wasn't there?
I think so. What do you think, Valerie? Trying to get back to life as you knew it before. Of course it changed.
Yeah.
Yeah.
Yeah, I not hear that.
Oh, okay. You didn't quite understand that one?
And I not all hear what you said.
Okay.
Okay.
Yeah.
How do you feel like your friends and your siblings helped you get through therapy?
Like my friend was helping me?
How do you feel about having had your friends and your family, your brother and sisters, being around to help? Did that help you, that you didn't feel on your own?
No, but I was small, so and it's already passed, so I can't remember that well.
Okay.
I think I only did have the visit of my parents. That's all.
At the hospital, yes, only parents were allowed. That's true. But when you came home, you had your brother and sisters and friends coming. Yeah. she got very quickly back into the swing of things. I would say that there were March, April, May, probably 3 very critical months that were involved with the diagnosis, the surgery, recovering from the surgery, the radiation that lasted 5 weeks, basically. And we're talking the radiation that now they refer to as the Middle Ages, because at that point, Valerie, they taped her head to the table because she was 4. Whereas in recent years, Valerie has had some side effects that have happened that have required additional surgeries, radio-induced tumors, and she has had gamma knife, cyber knife. So we see the technical advances with the masks and everything. Yeah.
Right. How is it? This is a big question for you, Edee. How has it shaped you, or how's it changed? Oh, I can see how it's physically changed your life, but how has it changed how you think about life and your family going through all this? Like,
No, it's just,
No.
I think that we have to realize that every day is a gift. And, every extra day that we have had with Valerie or with anyone has really been a blessing. I don't dwell also on only, had it never happened. I don't think about things like that. I think that we have to deal with the situation once we know what it is, and we are going to move forward. I think it's very important to say every day to your family that you love them and to greet the world with a smile and not be suspicious. I realized waiting in those waiting rooms for test results with people from many other countries that we all have this very strong common denominator. We all love our children and we want them to grow and to be happy. And we all will do everything we can to do that. So I think that I've always tried to project that and say, let's concentrate on the positive. We have another day, and not see in the distance, worry about some gray clouds that might be forming over there. We have to get on with everything and make the good happen.
Yeah, absolutely.
That is an amazing way to look at it. And I know, day to day, some of these things can get a little bit frustrating. And Val, you've made such amazing progress through this. How do you get through those more frustrating moments?
This is for Valerie?
Can you repeat?
Okay, sorry.
When you have some of the more frustrating moments because of the therapy that you've received, your mom has this beautifully positive attitude, that I think has helped you get through a lot of it. But I'm sure there still have been some frustrating moments for you. How did you get through those moments?
You were okay.
It was okay. You just plowed ahead.
Yeah.
You plowed ahead and you did it. It's interesting if I can say something about Valerie. She loves puzzles, and she will take 6,000-piece puzzles, which for me is chaos personified on a large scale. And she has her system, and she creates little boxes, does colors. And I am amazed because she creates order out of chaos. And that's how she does everything. She can have many situations that are tough and rough, and that you might think, oh my gosh, not again. But she just gets on with it. She sorts through and puts the pieces together and makes something beautiful in the end. So,
Right.
That is very impressive.
Yeah. It's a good analogy with how you've lived life as well, isn't it?
I think so. I think so.
Is there anything you would have, either of you two would have changed how you were treated, or maybe how you were spoken to, or anything you could go back and think, I wish, or I don't know, I wish I knew something a different time, or any advice or anything you could say to any clinicians or any nurses or anyone who just sort of say,
Right.
please don't do that, or please do this. This was really good.
I think it's so important to use the child's name and not refer to them as the little one or the kid. It makes it a very personal relationship right away. And the child needs to feel that this is a family. I mean, this is an extended family, but, that helps create the idea that we're all in this together. I have to say, when Valerie was diagnosed, the chief surgeon, I think lacked a little bit of psychology, shall we say, because the night before the operation, he said, okay, basically the kid has a 50-50 chance of surviving. If she wakes up, you might not recognize her. And, it's not, there's no guarantee for anything. And what do you think of that? And I remember thinking, oh my gosh, what do I think? I think that he could have handled it better. This is all new to a parent. I mean, the doctors deal with this every day, but a parent has just been parachuted into a situation, where their entire being is going on high alert and saying, I've got to do everything to help my child. So being spoken to like that was difficult, I have to say, very difficult. But we returned home that evening, and another doctor who would be assisting the chief surgeon telephoned us. And, he asked what had been said. And so I explained, and he said, no, I don't believe that's true. Your daughter's a fighter. She's arrived in very good physical shape. And I do not agree with, what was said to you. She has, a lot of good chances on her side. So he was very optimistic. And that I was so thankful for that conversation, because having left the hospital after the previous discussion with the head surgeon, that was not a good feeling.
Devastating to hear.
I can imagine. Do you, as a doctor, Jaime, do you get trained in how to give bad news?
That's a good question. So we don't really have formal training. We go through a fellowship program, which really is 1 year of intensive patient care and then 2 years of research. And so in our first year, we're really learning how to have those conversations from the doctors. And good at those conversations, we learn what we like about what they said, and we see how the patients react to what they've heard. And then sometimes that are not so good at that, and we learn what not to do. And so a lot of what we take away from our training is, okay, this is what I liked about what I've seen, and this is what I'll do, and this is what I didn't like, and this is what I don't do. And we continue, I think, throughout our careers to learn who our families are as people and who the kids are as people, and try to tailor those conversations to how we think that information will be best received. Wow. it's more of an art than an actual something that we've learned, and so a lot of variability in what I've seen for sure.
Well, I appreciated greatly all of the nurses and the doctors on the various wards that always took the time to get to know Valerie's story, to ask her questions about siblings. So the hospital has never been a place fraught with fear. And to this day, I mean, if we count all of the appointments, that it be for a visit with a doctor, a CAT scan, an MRI, physiotherapy, I mean, we're probably to around 2,000. And Valerie is never ill at ease walking into a hospital.
Good.
Wow.
Before any exam, she's amazing. She is just, we'll deal with what comes. So
That's really testament to Valerie, you, Edee, and to all the clinicians you're seeing along the way, isn't it? It really is a team effort on so many levels, isn't it? I remember when my daughter was diagnosed, we were going to hospital, I'd say once or twice a week for quite a long period of time. And every time my daughter, me and my wife would always get a warm welcome, but every time my daughter would get a really warm welcome, every time someone would always comment on her hair or her hat or her trousers or her jeans or something, without a doubt. And I think it was just second nature of some of the nurses just to make all the children feel so welcome. And I don't know whether they meant it or not. It's sort of irrelevant, but they did it in such a genuine way. They really made us feel welcome. I still remember that. And similar for my daughter, when we finished treatment, me and my wife, we were very happy, and we had a weekend away to celebrate the end of treatment. But my daughter was okay. It didn't mean anything to her because it wasn't stressful or painful or anything like that. So
right,
it's
that was very similar for Valerie. That they were so charmingly kind to her, and also Valerie took great interest in dressing and changing, and exactly the matching hat with the little outfit. And it made her smile. It made us smile. So despite where you were, it was a good day.
Yeah.
And as clinicians, we really do have fun with our kids. We do mean those comments when we say that. Love the little outfits and the hats that kids. We love our theme days. We have a lot of Disney theme days where the kids have kind of
Really,
we love that stuff. We really do.
yeah. Well, I remember one time, Valerie, you dressed in a tutu, and she had her little tutu, and she had this little bonnet that looked like Laura Ingalls Wilder, out on the prairie. It's just precious. Yeah.
You must have seen the inside of a lot of hospitals in a lot of different cities. So you must have seen, there must have been quite contrasting experiences and contrasting situations.
Yes, they were very different. Valerie, would you have to talk about different hospitals?
No, we're just used to hospitals.
We're just used to them. Yeah. Right. Well, we were introduced to the national health system when we moved to the UK after France. I mean, I have to say, when Valerie was diagnosed in France, we never had any questions about, are we going to be able to afford for all of these things? The French health system is such that if you have a major illness such as cancer, kidney failure, heart disease, things like that, it was covered 100%. So there was never any extra worry involved. I have to say, moving on to the UK, it was also the national health system, and you had private insurance. Additionally, Norway also. Each country that we really experienced with her treatment, there was never an issue, never an issue. And I mean, some of the buildings were, very old hospitals, but with modern equipment,
Right.
and that had been renovated. So no problems. Tokyo too. But Tokyo was really just the doctor's office, the neurologist office. Yeah.
That was where you and your husband were living there for a while.
We were, and Valerie came to visit us for a month, and that's when she started having these headaches. But we were able to immediately receive, an appointment to be received by a neurologist. So that worked out. That worked out really well. And then he provided, the paperwork, and 2 days later we were back in France and having an MRI, and surgery was, very soon thereafter.
Right.
That's great.
Okay.
Yeah.
Can I?
But although I must say, though, the staff, I'm sorry, they did try always to learn either a few French words or a few English words, depending if it was Norway or Japan, just to put her at ease. So that was really good. Yeah. Yeah.
Oh, that's great. That's great. I was going to ask you, Valerie, are there any members of staff that you have a fond memory from, or fond memory from any of the hospitals you've been treated at, or anyone you've come across that's really made a big impression upon you?
Okay. I'll just tell her quick.
Yeah, I know.
He wants to know about maybe a doctor that you know, that you still have contact with, that made a big impression.
Oh yeah, the doctor, from the beginning, because the first doctor who realized I did have this, who asked my mom to bring at the hospital, that was a fan of us. And also the doctor who was over there also would come to my room, and we saw back to England.
So what was that doctor's name?
Eric. Oh yeah, the one who I'm sure one of you.
Eric. Eric has been with you for a long time, with the entire family. Yeah. And has always been there to answer any questions, whether it was, in the UK or while he was in Canada. It was always very, very helpful.
Yeah. That's fantastic. Yeah, he is a good guy.
Yeah, me and Jamie we know Eric a little bit. Yeah, it doesn't surprise me at all to hear that about him. I can imagine him being like that with all his patients. Yeah, he's a very special person. Yeah,
he is. And when she was very little, he would come and go on walks with us, and it was wonderful. So it really made the hospital with a heart.
Right.
And the doctor with a very big heart. Yeah.
Well, you're still in touch with Eric now, is that right?
We are indeed. Yeah.
Right. Yeah, because that's how this all came about, isn't it? He recommended you to. So.
Right.
Oh, fantastic.
Yeah.
I had another question, but I've forgotten what it was. So.
Anything else you want people to know? What can we do better as clinicians?
Okay. I think you're doing a great job as clinicians, but I think it would be also interesting to put maybe some of the new patients in touch with former patients, if they're willing, kind of like a godmother, godfather type of situation. But I think that would provide a beam of light to see in front. That could be interesting. We didn't really have contact with other people who had been treated, because going in and out of the hospital, you don't. I think that could be very interesting. But I think that I think we really have to say, just don't let cancer define you.
Yeah.
That's interesting what you say about new patients and former patients, because the ward where we went to, they had a photo wall outside, and there was lots of former patients added pictures. This probably happens in a lot of hospitals. And there was pictures of former patients who had graduated from university or had got married or who had kids. And when you're in there and you've been told that you've got treatment for the next 2.25 years or whatever, then it just seems you can't imagine the end of it. It just seems you don't even really want to think about it. And talking about what you said earlier, it's literally taking everything one day at a time. But when you see photos of people who've been in a similar situation, and you see them smiling on their wedding day or graduation day, that's really nice. It's sort of it makes me feel nice just talking about it now. But that's interesting how to involve new patients with former patients.
Right. I think it would be beneficial for both. I mean, the older patients will see again the road they've traveled and how far they've come, and they will realize they can be a bridge for that younger person.
Yes, I wonder. I don't want to put you on the spot, Jaime, but is that something you could see working? I could see it working, but I don't work in a hospital, so I don't know. I've got no idea how it would manage, but just hearing it sounds like a good idea, doesn't it?
It does. Actually, we've done it for some patients whose families have requested to meet with somebody who's gone through their process before. I don't know that we uniformly do it, which is probably a better idea to start actually asking that question up front to new patients. I think that's a great idea, because I think people who have gone through that process and had somebody, almost as a mentor to them, if they've gone through it before, has been beneficial. So I think it's a great idea to start asking patients up front.
And has it worked well where you've done it before, Jaime?
Yeah.
Right.
And I think, key is finding somebody that has done well with it, that has that good attitude about it.
Right.
Yeah,
that would be better.
Have a great attitude. You've been able to get through a lot of challenges. A lot. So I think like you would be perfect to be a mentor. That's something you would be interested in?
Valerie?
I didn't know that's not more interesting of what.
I think you would be interested in helping if there's other people who have cancer and who are going through it, I think you could bring a little ray of sunshine to their lives.
Yes, there was them and bring out love to them and whatever.
Yeah. And I think too, it's important that that the patients feel that they can ask for help if they are feeling overwhelmed. That it could be suggested to them. Don't hesitate. I mean, I don't remember hearing that. Maybe we did, but there was an awful lot of things going on at that time. But I do think that insisting that, we're here for you and just ask for help. I mean, they know they're being looked after by an entire village.
That's definitely true.
Yeah, I met a nurse recently who's doing some research on the parents of children that were going through cancer, and she was saying that in some countries there isn't much support for the parents, And when I was going through it, there was a lot of care shown to me and my wife from the clinicians, but there was nothing systematic towards really looking after the parents. I don't know whether that's due to not enough
Right.
experiences, but there wasn't. If me and my wife were having if me and my wife were having problems, we'd have had to look for help. I'm not sure if we would have looked hard enough, maybe we could have found it, but it wasn't apparent that it was there. Perhaps it was.
Yeah. Yeah, the same here in France. It wasn't apparent that something was out there. No. But, I mean, we didn't feel the necessity, but some people might. So that could be helpful for them, I think.
Yeah. Do you have that sort of thing in your hospital, Jaime?
We do have a social work team and palliative care teams, and then we have child life specialists to help with the kids.
Okay.
So sometimes that's enough. Sometimes we need extra psychologists on top of that. And so I think it really is dependent on who the patient is baseline. Was that a child with good coping skills? It's kind of baseline. If it's a teenager, so somebody that came in with additional struggles that maybe needs additional help on top of that. Yeah, we have at least those basic services, and then we consult out for additional help sometimes.
Okay.
I think there's also cultural issues as well. I think it's slowly changing over here, but it's say you go back a few years ago, I don't think people really spoke about mental health problems, or if they weren't coping, they'd just be thinking, I need to focus on my child. Don't worry about me, even if I'm really struggling. So I think that's probably quite hard to break that barrier down, isn't it?
Right. Well, I think that.
Sorry, yeah, carry on.
No, you go ahead.
I was going to say there's probably a difference between America and, I don't know, maybe Europe or the UK. I don't know. Americans more likely to talk about those things than British. I can imagine British not really wanting to talk about those sort of things. I don't know.
Yeah. Maybe Jaime has more of a take on that one since she's over there.
Yeah, we have so many different cultures here in the US. Like some cultures, people are very open to talking about things, and some cultures, it really is a family issue that's discussed at home, and you don't talk to strangers about things. And I think, even within a culture, there are some people that are stricter than others and how much they're able to open up to people. So I don't know that it's one single answer. I think you really do need to get to know the families.
Yeah. So what's next for you two? Is there any plans of going abroad again, or are you happy where you are in France, or one day at a time?
Right. Moving abroad for the moment, that's not on the agenda. But as we do have, a son in the U.S., we go over there and visit. And I think every place that we've moved to, we've made friends. And it's always nice to go back.
Yeah.
And, I have people who say to me, well, so tell me now, which is the best country, that you lived in? And I was like, there's not a best country. They're all wonderful. We've met great people in so many places. So no, I won't give them the best country answer, but, so we'll continue to go and, visit friends and do things like that. Valerie also helped us out with, my husband and I were, volunteers for an association in France that's called Edee, which is like in the US, Canine Companions for Independence. So we have raised puppies from 2 months to 18 months to then go in for a further 6 months.
It's Jaime's world, isn't it? Yeah.
Okay, Jaime. So we've done that, and then we receive them. Also, now we don't have a dog for the 18-month period, but we do weekends out of the training center, or if a recipient needs to go into hospital for an intervention or something, we'll look after them because we know the commands.
Boy.
But that's great. And Valerie enjoys those dogs a lot whenever we have a new little one coming by.
You have pet therapy in the hospitals at all?
Well, when Valerie was a child, there was not. No, they did not. But nowadays they are allowing certain dogs into the hospital. Yeah. But I think it's marvelous, and they do a great job. They do a tremendous job. Yeah.
It's quite a challenge to do that, though, isn't it? I can imagine it makes a really big difference to some children, but how to do it safely that's quite a challenge, isn't it?
Right. If it is for a child, it could be an autistic child. It could be multiple handicaps. There, the person in charge would actually be a parent, but the dog is there to stimulate the child, and that works really well. So they raise them for that. We also have them for people in wheelchairs, opening doors, turning on and off lights.
Yeah.
Things like that. Yeah. Some very interesting things. But we had dogs before in our family, and we thought they were well trained. Then we realized once we started going to these classes for these dogs, it was a joke, what we thought. But yes, quite amazing.
Is your dog well trained, Jaime?
I think so, but we have a dog who comes to the hospital to visit kids, and it's my dog is not trained like that dog.
And does this dog go from room to room and put his head on the bed or on their lap or something? That's
Yeah, and I guess still enjoy having the dogs.
Yeah, it does make a big difference.
Yeah.
I mean, they help quite much the dogs. Making patient.
I don't. They must do it in some of the hospitals in the UK, but I haven't heard of it. But I'm sure they do, because the benefits have been talked about for a long time now, haven't they? They really do help a lot of wide-ranging, different lots of patients. You can take your dog in, Jaime. Put it in one of his, because Jaime makes amazing suits, or you have done when he was smaller for the dog, so you can dress the dog up and then take it in.
You give him Halloween costumes. But then he has a whole wardrobe. Have to do an extensive training program before they're actually certified to be a pet therapist.
Yeah.
Yeah, of course. So that was quite silly suggestion. And so, okay. Is there anything else you'd like to say about what you've been through, or what you're going through, or anything else because the audience of oncology is professionals involved in cancer, but there's also a sort of wide-ranging professionals, but also parents as well. I can't think of the other people. So if you have anything else to say, but what you've said so far has been fascinating and really inspiring as well, really genuinely.
Mm. Would you like to say something?
All right. Yeah. Tell again. I do not.
Would you like to add something else to say?
No. I love to see what. No.
No, you're okay. Well, what I had mentioned before, and I think this is what we have to remember, is about not, we're not going to curse the roses for having those thorns. We have to thank the thorns for all of the roses that we see. And despite, tough times, multiple surgeries, losing quite a bit of hearing, there's always something that we can be very grateful for. And we just have to keep that in mind. Yeah, I think we have to do that that way.
That's perfect, because I actually had it written in my notes. I wanted to mention your quote about the thorns, but now you've just mentioned it in a much more eloquent and articulate way. So thank you. Do you have anything to add, Jaime?
Oh, I just want to thank you both for meeting with us and sharing your story. It's really, your optimism is beautiful. And I'm excited to share this with other people who may be going through a similar journey, because I do think the way that you've gotten through this and been so successful in really keeping up that positive attitude is really commendable. So thank you.
No, thank you. Thank you for giving us a chance to share.
I think we hear quite a lot about positivity, and there's also the term toxic positivity, where you just sort of pretend everything is great or everything will be great. But your approach isn't that at all, is it? It's appreciating what you have rather than trying to sort of fool yourself that everything is wonderful or everything will be wonderful. So your approach really is, it can apply to anyone in any situation, can't it? It's appreciating what's happening now and try not to worry about what's going to happen in the future, but still being aware of what what could happen, but just sort of not focusing on the now, isn't it? So fantastic. So like Jaime, a huge thank you to both of you for your time. So
you're most welcome.
Right, thank you very much.
Our pleasure.
And a big thank you to Eric for making this introduction as well. So great, thank you very much. Right, okay, brilliant, great.
Thank you. Okay. Bye-bye.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.